who have success with TMS will need some booster at a future point. 60% have not needed any and continue to do well. And those who do need booster, we advise them. We try to follow up after the treatment, monthly or every 2 months to make sure it's holding. If there's any indication of a setback, and we do rating scales weekly to make sure if there's even a slippage, 10%, we jump at it. And not just with TMS. As Tracy mentioned, we have counselors, psychology, cognitive therapy. We counsel on exercise, lifestyle. TMS clears the depression. But a lot of people with depression live in a cave for a long time. So sometimes the challenge is to get them to change new habits, to learn to smell the flowers and enjoy the sunshine and things they haven't done for a while.
I should have asked you, can schizophrenia be treated with TMS?
Not at this point, except one type called schizoaffective where there's a significant depression component. We've treated the depressive phase. But to modify schizophrenia, it's not mainstream yet. There are some trials for visual and auditory hallucinations, but it's not yet FDA approved. As I said, the brain is an amazing organ. Once we figure out every aspect of the brain, we're going to be able to stimulate it or tone it down appropriately with non-invasive technology.
And our brains change every day, right? The chemicals, restructuring what we do, and kind of like the full scheme of lifestyle can impact your brain health, whether it's exercise, nutrition, meditation. So if you are able to adapt all those things to keep your brain clean, if you will, after you have the TMS cleaning done, bring in a housekeeper.
Yeah.
Right?
One thing I wanted to mention, because it often comes up, is how about medications if somebody is on medications? So when we do TMS, if you're on medication, we don't have to change anything, at least until we finish the course of TMS. And again, I'll give you our experience now, many hundreds of patients we treated. I'd say 1/3 of our patients who've successfully been treated are off medications completely. Another third are on much less medications. On our website, there's a school teacher who says 2 years after TMS, she is on half a dose of one medication when she was on 5 medications before, and she's 1,000% better. And the third are those who are on like 1 or 2 medications and were stuck, and now they're functional. So TMS acts as a booster to get them out of the stuckness they were. So there is no right or wrong. Some people do need medication, but a lot of patients can lessen the amount or eliminate them altogether in about 30 to 40%.
Could you discuss another treatment that's ketamine injections that's supposed to be helpful for the depression?
In our quest to really not have any obstacles to treat patients, now we have a new treatment that's not yet FDA approved called ketamine infusion therapy. Ketamine has been around as an anesthetic and has been used in pain conditions. But there are some amazing studies in depression, in the acute treatment of depression. One of my new doctors in the group was running a program in a university setting for ketamine with amazing success rate, 70%. We opened a ketamine clinic in July, and now our success is 80%. With amazing. So we use it as another tool, and it involves, we have an infusion nurse, we have an infusion center in our San Jose office.
So that would be intravenous?
Yes, we do intravenous. It's 3 infusions the first week, and somebody has to drive them in. They're in for about 40 minutes, and then the second week, 3 infusions, and you're done. However, we found out that people will need maybe a booster infusion every 3 to 4 weeks after the acute course. But it's been miraculous success for severe depression. And we position that after TMS, because TMS is FDA approved, but we don't give up. If we don't really, with TMS we've had 86% success rates, but those 14% who have not gotten well, they've gotten better maybe, but not well. We have 3 people now. We combine deep TMS with infusion, and life can't be better with them, so we're happy. I have to share this with you, if I may. The day that Robin Williams killed himself, I was in my San Francisco office, and my associate said Robin Williams, it was a Monday afternoon, killed himself. And we knew in the news that he had been depressed. My first reaction, and he lives in Marin, my first reaction is why didn't they send him to us? And he had been in mental health and chemical treatment. I wish I could have treated him, this genius of a comedian who obviously had, had Parkinson, depression. We could have treated him with TMS.
Well, thank you both so much for coming and being on our program. It's been wonderful having you and so beneficial to many people. Thanks again.
Well, thank you for the opportunity to speak to you and your audience. And I tell you, I'm in this to get people well as much as we can. So hopefully everybody who has felt hopeless or depressed, please don't give up.
Hi, I'm Michelle. I've recently been doing the TMS treatment. At first, I was extremely depressed. It was very debilitating for me. I had no personality. I had no life. I couldn't function or do my daily activities. I didn't get pleasure in doing anything. I've been suffering from depression, severe depression, on and off for about 9 years now. It was so frustrating to have psychiatrists try to prescribe me different medications and telling me, oh, it might take 4 to 6 weeks to work, if it even works. It's like I had no hope. The fact that I didn't know when I would snap out of my depression was just horrible. To wake up every day just feeling very down, not being able to get out of bed. I couldn't function at all. I just had no quality of life. It was really hard. When I was in the depressive episode, that I didn't think that we could have kids because I can't even take care of myself when I get like that, let alone take care of another human being. Finally, I looked into alternative medicines and I found out about TMS. So I decided to try it, and literally I just go in there for 37.5 minutes and I just watch Netflix. There's a technician in there with me, that's it. And it's just a tapping on the left side of my brain, and I had no pain or anything. I have more energy than I've ever felt. I would get up, work out, go to my TMS treatment, then grab lunch with a friend. I'm so productive. I've never been so clear about anything or had this much energy. The fact that I don't have to be on medication. I've already started decreasing my medication since I finished it, and no different. I still feel amazing. And I'll be off medications completely in a few weeks, and I couldn't be happier. I'm so excited about my future and just about getting the word out there to other people. I just want to help as many people as I can by telling them that this amazing treatment is out there.
We're happy you joined us for this important program, and we look forward to having you again next time. Goodbye for now. For additional information, we suggest you check out this following website, and we recommend reading on mental health subjects with the following books.